Welcome to the Finding Mental Health Care in Washington, Where to Start class. A team of case managers from Seattle Children's have put a series of videos together to educate caregivers on how to navigate mental health resources in the community and the different levels of care. Please note this class will be discussing how to access resources in the community and not focus on services at Seattle Children's Hospital. Before we begin to talk about how to access community mental health, it is important to understand some basic information that affect access to care, starting with Washington state consent laws. In Washington state, youth may consent for their own mental health treatment at age 13. This means that youth aged 13 through 17 can independently seek out medical treatment without consent or knowledge from their parent or caregivers. If a child wants to seek out substance use support or mental health evaluation independently, they can. Youth between the ages of 13 through 17 must give formal written consent for their parents to access their medical records, though there are situations when a provider does share information with their caregivers without child's consent. These include any immediate safety concerns, such as your child having a plan to hurt themselves or someone else, information about a crisis and safety plan, diagnosis and recommendations for treatment, including medicines and progress in treatment, suggestions for support, and referrals for other services. Note that each state has their own consent laws, so age of consent for mental health treatment varies. This is Washington specific. You can read more about teen privacy rights on the flyer titled Teens and Privacy Rights found below this video. There are different levels of mental and behavioral health care in Washington state. Starting from the least intense to most intense, these include outpatient care, wraparound services, intensive outpatient programs, partial hospitalization programs, inpatient hospitalization, and residential treatment. If a child's needs increase, the intensity of the services ideally increases as well. Many children will not need all types of treatment, and not all of these levels of care are easily accessible in Washington. Most have admit criteria and wait lists. It is important to know what level of care your child has been recommended to access, and if you have never accessed anything, starting with outpatient care will be the first step. If you're interested in learning more about how to access outpatient services, please watch the Navigating Outpatient Care videos. Navigating the mental health care system can be difficult and confusing, and sometimes you may find yourself in a state of crisis. At the end of the series, there's a video on what to do in a crisis situation and how to seek help. Thanks for watching, and please take the survey on the class page to share your feedback on these videos.